Ladies and gentlemen, boys and girls, my name is Subrata Sarkar. I'm a mechanical engineer working in manufacturing industry since last 22 years. Today I'll discuss about a disease called Alzheimer disease. It normally happens with older people, but problem is day by day, it's going a major health issue for the senior people in all countries. Now, what is Alzheimer disease actually? It's basically a disease of irreversible progressive brain disease and slowly destroy the memory and the thinking skill. So, Alzheimer disease is a brain disease, and there are two main areas actually it attacks. Your memory, you will be losing memory significantly, and your thinking capacity of the brain will be lost actually day by day. Now, there are some statistics about Alzheimer disease. Alzheimer disease is the most common causes of the dementia among the people of age above 60 or 65 age, and scientists have estimated that around 4.5 million people now have Alzheimer disease only in US, and altogether the whole world it's more than 10 million actually at this moment. And every year, like 5-year age group between 65, what I mean to say is normally this disease starts after 60 years, but 60 to 65, 65 to 70, 70 to 75, that's the quantity is becoming double actually. So as you are getting more older actually, so probability of this disease is more actually. Now there are also, like by 2050 is saying that by only in USA 30 million people will be under this disease actually. And most unfortunate and discouraging information is at this till this moment actually there is no prevention treatment is available. As you know, for cancer there are a lot of treatments are coming. It depends on the which stage of the cancer, but this Alzheimer disease as on date no treatment is available actually. And the reason, only reason is that the symptoms when comes, and the reason starts maybe 20 years before actually. Like someone has got this you can find the symptom of Alzheimer's disease at the age of 60 or 65. Actually the reason for the disease that was started at the age of 45, and which was very difficult to identify actually. That is the main reason it cannot be identified immediately, not so. But when it happens, then you do a lot of diagnosis process are there. Then you can find there are a lot of feature in the brain actually which identified or confirm that you are in Alzheimer's diseases. And as far as what is that there is no medical treatment actually in hospital or so called. It's basically people need to take care of your relatives, and so this is actually still this, as per the medical science has no good answers for this. Now to understand the Alzheimer's disease, we need to have a basic understanding about human brain actually, how the brain, what are the quantities, what are the parts of the brain, like that. For example, like the adult brain, the weight of adult brain is 3 pounds, like 1300 grams for a normal standard human being. And the adult size, this is a medium size cauliflower, the size of the brain. And number of neuron, 100 billion neuron is the normal quantity of this everybody's brain. And the number of synapses, 100 trillion synapses in all brain actually on an average. Now there are three main players of this for the disease of the area of the brain actually which are responsible for the diseases. Number one is the cerebral hemisphere. Is account 85% of the brain weight actually, and consists of the two hemispheres connected by a bunch of nervous system which connects between the left brain and right brain, which called the corpus callosum, and covered this called the cerebral cortex. And number two areas, important area of the brain is the cerebellum, and the balance is actually in charge of the balance and coordinations of the brain. It takes about 10% weight of the brain and consists of the two hemispheres and receives information from eye, ear, muscles and other places. And the number three is the brain stem. This is which actually the narrow portion of the brain and which connects between this this is a spinal cord and brain. This is called the brain stem actually. This is relay and receives, and it contains the automatic function and it is responsible for doing a lot of automatic function like your heartbeat, your blood pressure. That is actually brain stem is responsible for. And when somebody got affected with this Alzheimer disease, it attacks actually all the three areas. Now, there are also some crucial parts of the brain. One is the hippocampus, one is the thalamus, another is the hypothalamus, and another is the limbic system. Now, brain action by PET actually, that is a testing like MRI. We do a lot of scanning process. There is one scanning process called the positron emission tomography, that is PET, by which you can check whether your brain, like these symptoms of the reason is generating inside your brain for Alzheimer's diseases, so that it can expose when you will be after 60, 65 or 70. So these PET testing by process, which you can see a lot of feature inside the brain actually. And by this PET testing, you can check actually like different area of the brain are get activated when do something actually. For example, you can see there are 4 picture, and in the first picture actually when you are hearing words, so these are the area will be activated in your brain, and when you are speaking words, this area of the brain will be activated. When you seeing something, seeing words means you are seeing something, so this area of the brain will be activated. And when you are thinking about words or thinking about something, this is the area of the brain will be activated. So this can be seen by the PET process actually. Now inside the brain, the balance of neurons and all these things, to stay healthy, you have to do a lot of you need to keep your brain activated actually always. This is the main actually one of the protective long-term protection which you can do actually by this. Now this is the scan copy, like scan a picture actually, like when someone has got by doing this PET, and if you find this type of the triangle in your brain, this tomography PET, the positron emission tomography, so this is the actually showing that you are there will be Alzheimer's disease in the near future actually. Now, and if we see, you can see here there are the 2 picture. One is this picture, PET scan for the normal brain and PET scan for the Alzheimer brain. So someone who has got the disease, Alzheimer's disease, so activity of the brain will be less actually, and here the activity of the brain is more for the normal brains. Now Alzheimer's disease, in cancer we say so is a very preliminary stage, is a very this is a mature stage. Like in Alzheimer's disease also, it has got 3 stages. One is the preclinical stage actually, and this is a nerve cell actually started dying actually by slowly, and changes begin 10 to 20 years before the symptom appears actually, and known as disconnected memory losses, like sometimes you can remember something and sometimes you cannot remember something. So these are the preclinical stage of the Alzheimer's disease, and there is a mild Alzheimer's disease sign, and this includes like memory losses, confusion. Sometimes without a reason you are getting confused actually, your mood is without any reason get changed. So these are the symptoms of the mild Alzheimer's disease. And moderate Alzheimer's disease is an increased memory losses. Your problem in recognizing people actually. You'll find there's older age people, they can recognize actually at the time their brain is not working actually, or Alzheimer's disease in severe stages actually. And severe stages of the Alzheimer's disease are you lose weight actually, a lot of skin infections will be there other than the memory losses and all these things. Now, probable cause Alzheimer's disease, one is the genetic disease, and another the lifestyle is also matters for Alzheimer's disease actually. Like how the people this. Now, lifestyle in science, like if you are doing work or your lifestyle is such that your brain works less, then there is a possibility of Alzheimer's disease from the lifestyle point of view. What I mean to say, there are a lot of work, but your brain needs a lot of activities. So there is a possibility that these people will have less chance of Alzheimer's disease when they will be in older age. And recently scientists have found that Alzheimer's disease is not happens only after 60 years. It has got 2 categories. One is between 30 to 60 years, another is the between 60 years above actually. Now, it is also recently found that like uh, stroke, like brain stroke, also lead to Alzheimer's diseases in long term. Suppose the person has got some brain stroke at the age of 50, maybe at the age of 55 or 60, he will severely attacked with the Alzheimer's disease. So a lot of things will he or she will forgetting, etc. So protection for Alzheimer's disease, as I said, there is a one there's a mental stimulating, or your there's you should do or think or your activities such that your brain should be engaged. That is very important. So that this is a preventive measure for not having Alzheimer's disease in future actually. And if like someone in your family is in Alzheimer's disease, so you should plan accordingly. Now a lot of research is going on actually Alzheimer's disease to find some solution, etc. So one of the important factors is cholesterol lowering drugs. This can be helpful for the Alzheimer's disease. The anti-inflammatory drugs and the nerve growth factor are these three things actually we need to take care of the Alzheimer's diseases. And support for the caregiver actually, if someone has got Alzheimer's disease, there is no use of getting admitted him or her into some hospital or nursing home. It doesn't work actually. Like family member and all this, that needs to take care. And if they forget something, so we have to behave with him or with him or her the patiently like that, because we need to understand that now his or her brain is not working and memory is getting lost. There are a lot of inactivity is coming into brain day by day, and that is also increased. And as on date medical, it is there is no good solution is not found. So those who are still today they're with this problem, so they should keep in touch. There are a lot of this association like American Alzheimer Association, a lot of others. So the people should get connected. So if any new solution or the medicine comes, so they can get informed. So if you find this presentation is important and informative, you can share with your friends and family so that people get support and help. Thank you very much for your attention.